I have an 83-year-old gentleman who has diabetes mellitus type 2, and of course he's not quite as controlled as he could be. His A1C is around 8%. And he has some issues going on at home. He has a wife that has some memory impairment and an adult son with special needs. He showed up in my office over the winter with some ulcers on his legs, and they looked hideous. He had a cellulitis around them. I thought, oh, these are going to need surgical debridement, and he would definitely benefit from a visiting nurse going in, doing some wound care with him, some dressing changes. And unfortunately, because of the home circumstances, he really didn't feel that having a visiting nurse coming into his home was a good idea. He knew, though, if he didn't get the care that he needed, he would probably end up in the hospital. And we talked about that these types of infections can go from 0 to 60 very quickly and even require amputation. I was so fortunate because I have a partner who's a vascular surgeon. I picked up the phone, I called him, and I was able to have the patient seen the same day with the vascular surgeon. And not only that, the vascular surgeon worked with me, taught me how to apply an Uniboot for this gentleman, and I was able to also arrange transportation for this patient to come to my office once a week. So once a week I was seeing him, I was changing the Uniboot, and on alternate weeks he was following up with the vascular surgeon as well. Lo and behold, 12 weeks later, his legs were beautiful, and we had a patient that was very happy. We were able to keep him out of the hospital. We protected his vasculature and his legs so that he does not require any additional interventions. And because I was seeing him every week, I was able to get his hemoglobin A1C down a bit as well. So I felt very good about that. Win-win.